Hey guys, it is first thing in the morning, so I'm still waking up, but I want to get this done. Sorry, I have gum in my mouth too. Trying to keep uh, awake, um, get my coffee to kick in here. Um, but I'm going to go over the anti-anxiety and antidepressant drugs today and sleep drugs. So it kind of goes through a bunch of different things. I think this is pretty interesting, especially with mental health being kind of on the forefront of a lot of people's minds these days. So hopefully you'll learn something interesting and learn some stuff that you need to know too for your certification test. So I'm going to present now. And we will look at the PowerPoint. Okay, so we're first going to go over anti-anxiety and antidepressants. Just so you know, a lot of these work for both. So I'm going to try to break that down because some of them mainly treat depression, but they can treat anxiety also. And then there's like acute anxiety drugs that just treat anxiety. But a lot of antidepressants actually can treat general anxiety disorder also. So just know that. And I'll probably talk about that a little more here in a minute. Okay, so antidepressants, they are a popular medical treatment choice for depression. There can be chronic depression and situational or acute depression. Although antidepressants may not cure depression, they can reduce the symptoms of it. The first antidepressant you might try may work fine, but if it doesn't relieve symptoms or causes side effects that bother you, you might need to try another one. So it's just really important that a person who's on antidepressants is working with a doctor really closely because it can be they can have really severe side effects. And if you're already dealing with mental health and then it actually makes your mental health worse, that can be a huge problem. So some things to consider. So with antidepressants, your healthcare provider and you will kind of think about these things. So your particular symptoms you're having, possible side effects, interactions with other medications, pregnancy or breastfeeding, because that's a huge thing in pregnancy and breastfeeding or postpartum. Depression could be a really major thing. And during pregnancy too, no one really talks about this, but depression during pregnancy is really common as well. But there's side effects to every medication. So it's really important that pregnant women talk with their doctor about like what drugs they should take or if there's other options that are not drug related that can help. Other health conditions or contraindications and cost and health insurance coverage because a lot of times with antidepressants, it can be expensive just going to the doctor, every time you're, trying to get your prescription filled or maybe something's not working for you. It's like that's important to consider. So types of antidepressants. You've got selective serotonin reuptake inhibitors or SSRIs. Now, doctors often start by prescribing an SSRI. It's like the most common one that they will start off a patient with. These medications generally cause fewer bothersome side effects, and they're less likely to cause problems at higher therapeutic doses than other types of antidepressants. And then some common ones are things like Prozac, Paxil, Zoloft, Celexa, and Lexapro. And some of those are actually also, if you look them up, I'll have you guys look them up for the list. You'll see that some of them say treats anxiety and depression. So a lot of them will treat, especially SSRIs, can treat both. Serotonin and norepinephrine reuptake inhibitors, or SNRIs. These include Cymbalta, Effexor, and Fetzima. And those are just another kind that can work if SSRIs don't work. And then you've got atypical antidepressants. These medications don't fit neatly into any of the other antidepressant categories, and they include trazodone, marazepam, or Remeron. the Trintellix, Vibrid, bupropion, or Wellbutrin. And bupropion is one of the few antidepressants not frequently associated with sexual side effects, because a lot of times that's one of the bigger things, is that people feel like they're kind of flat in all areas of their life, maybe sexually with their partners, like or even just like romantically, like they don't feel like any sort of way towards them, like their partners specifically. But also that's kind of one side effect of all antidepressants. A lot of people feel is that they feel really flat, like their personalities feel flat. Sometimes it can make them feel numb, or like instead of feeling like really sad or anxious or like whatever they were feeling before, they don't feel anything. And so that can be really hard to deal with as well, because it's like, what would you rather have? You know what I mean? So while some people feel more normal and calm and better, other people can have that feeling, and then that create problems in their relationships as well. So that's just one thing to think about. You've got tricyclic antidepressants, such as tofranil, Pamelor, norpramin. These tend to cause more side effects, so doctors usually will not start with tricyclic antidepressants. MAOIs, they're still out there, but they're pretty uncommon. Doctors don't like to prescribe them because they actually can be affected by a lot of foods. It's really interesting. Using an MAOI can be dangerous or even deadly because of the interactions with foods such as cheese, pickles, and wines, and some other medications, including birth control pills, decongestants, herbal supplements, which tons of people take herbal supplements. And so it's super uncommon for doctors. Well, I mean, maybe not super, but they usually just don't do it because people tend to not be smart about stuff and forget, and then they can take, like, if they're eating too much of a certain food, it can affect that medication. So okay, so let's see. Antidepressants and risk of suicide. This is a really big issue. Most antidepressants are safe, but the FDA requires that all antidepressants carry black box warnings, which is the strictest warnings for prescriptions. In some cases, children, teenagers, and young adults under 25 may have increased suicidal thoughts or behavior when taking antidepressants, especially the first few weeks. And keep in mind that antidepressants are more likely to reduce suicide risk in the long run by improving mood. But there's something about young people that I would say, and I would caution everybody about this. There's something about young people that they don't really understand fully, like science doesn't, as to why antidepressants can cause such a different reaction in children and teenagers, especially. A lot of times you see with those with homicidal teenagers, which means they are at risk for killing other people. A lot of them, are on or can be on antidepressants. That's a very small percentage of them. But that was one thing that they kind of linked to, was it can cause that, and it can also cause suicidal thoughts. So they found that that's really pretty common with children and young and teenagers who are on antidepressants. That's more common than anything, is just a worsening of depression, unusual behavior, or suicidal thoughts while taking them, which kind of is almost worse. It is worse, obviously, because it's kind of going in the wrong direction there. Obviously, if you or someone is going through this, I would just really caution you to work with a doctor, because you guys are teenagers and you may have family members or brothers and sisters who are, on medications like this, or thinking about it, or your parents are thinking about it, or whatever it is. But it's really important that you are aware of how you're feeling at all times. And I think that's really hard, especially for children, because I've heard young children having to be on these kind of medications, and it can really affect the brain. We just don't know like how much it's actually affecting the brain even long term. So that's really something to think about. That's also a question on the certification test. They talk about what is a risk involved with teenagers taking certain medications, and like the answer was like antidepressants and suicidal thoughts or something like that. So that has been a question on the test over the last few years. So that's all I'll say about that. Things to consider with antidepressants: patients should avoid alcohol, recreational drugs, mixing other drugs. And then common side effect is dry mouth. And I would say also things to consider just in general would be to look at other options for besides drugs. I always usually talk about this, but like counseling is really helpful for people, and can be a really good outlet for somebody going through something like, anxiety and depression. And obviously you or whoever it is, that person can only decide what's best for them. And if medication and their doctor, but if they think medication is best for them, like, then go for it. But I would say, even a balanced approach with counseling could be helpful for pretty much everybody. I think counseling has a stigma to it that a lot of people don't want to, they think that's for really bad people or people who are going through something really hard, but that's not actually true. So that's what I'll say about that. And then anxiety disorders. So some examples of anxiety disorders include general anxiety disorder, social anxiety disorder, phobias, and separation anxiety. You can also have acute anxiety as well, like where panic attacks will come on. And that is where it's kind of hard because you feel it coming out of nowhere and you don't know why it's happening. And a lot of the time, those people don't actually have general anxiety, which is like this kind of like undercurrent of anxious thoughts and anxiety. Like sometimes those people are totally fine and then have like an anxiety attack that is triggered by something. So all of those can be different depending on like what it is. So some symptoms: feeling nervousness, restless or tense, having a sense of impending danger, panic, or doom, having increased heart rate, breathing rapidly, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than present worry, having trouble sleeping, experiencing GI problems, having difficulty controlling worry, having the urge to avoid things that trigger anxiety. So that's a lot of symptoms right there. Some of these people have a few or most or all or whatever. It just depends on you. But those are just some things that you could deal with. And I think everybody probably goes through some kind of anxiety. Like I think it's rare to not have some of these things sometimes. But when it's the biggest key issue, I think, for mental health is it affecting your everyday life and your quality of life? Like that's what you have to ask yourself. Or is it something that you deal with from time to time, but you're able to kind of manage it? Are you able to, use coping strategies? And even could you learn coping strategies to help you through that? Like, is it severe enough to where you actually need to seek out help, or is it something more normal? And I think, you should just know, like, especially in school, like you should have some level of a little bit of anxiety here and there over like a test or, making a good grade, but like, is it affecting your everyday life to the point where you can't sleep or, you're having GI problems? Like, are you having, panic attacks, like breathing rapidly? Like you just have to kind of think for yourself if that's something that's taking over your life. So anti-anxiety medications, antidepressants for chronic general anxiety disorder. So antidepressants, particularly these SSRIs, are widely used to treat anxiety disorders, especially general anxiety disorders. So I talked about some of these on that first slide: Celexa, Lexapro, Paxil, Zoloft. A lot of these can be used for anxiety. Cymbalta, Effexor, Tofranil. All of these can be used for for chronic general anxiety disorder. For acute symptoms, I think doctors are they're starting to realize how bad benzodiazepines are, and how they can be really, really what's the word? Hard to get off of. So they could be potentially abused. But also, even if you're taking it regularly, like you're supposed to, you could still become dependent on it to the point where you're having horrible withdrawals if you get off of them. So I would say these are at some point going to be moved to a higher or lower, I guess, schedule. Because I think Xanax, all of these are probably Schedule 4s. Ativan's is Klonopin and Valium. All of those are Schedule 4s. And originally, they didn't think they were that addictive. The problem is it's not that they're addictive like opioids are, but they are very, they're like body dependent. Like your body just gets dependent on them very easily. And so then you have horrible side effects when you try to get off of them. Yeah, there's a guy named Jordan Peterson. I don't know if you've ever heard of him. He's kind of a prominent political slash, he's a writer, author. I think he's from Canada actually, but he kind of is like he wrote a book and is kind of a figure in society right now. But he had to kind of peace out for a while because he got so addicted to benzodiazepines, and he had to go to like Russia to get help to get off of them. They had to put him in a coma because it was so bad. So like he's kind of been a person who has talked about this, like, and how bad it is, and how even doctors sometimes don't really tell you how bad it can be. So that's one of those things that if you're interested, you could look up. He talks about that, I think, in a YouTube video. So I think that's kind of interesting hearing from somebody who's had to, get off these drugs. And then you've got sleep disorders. So if a patient's regularly having trouble falling or staying asleep, like having insomnia, a doctor may recommend insomnia drugs. Sometimes it can be an underlying medical condition. Like right now, I have a pregnancy as an underlying health condition. And so it's, hard to sleep just because I'm pregnant, but I'm not going to get on like a sleep medication, because I think that, well, for one, it's probably contraindicated in pregnancy, but two, it's, you don't want to give your baby sleep drugs and stuff like that. But if you have insomnia for other reasons, sometimes your doctor will prescribe something like Lunesta or Ambien to help you sleep. I would say some of these you got to kind of be careful because they can have side effects. They can cause, night terrors, and you do things and you don't remember them in the middle of the night. And so it's like, it's kind of, being on these type of drugs are really, I don't know, it kind of freaked me out. Like, what would I do? Some people are totally fine and just fall asleep and stay asleep for 8 hours and they're good. But other people, do like weird things when they're on these kind of medications. So there are some side effects with that. And that is it, you guys. Yeah, I hope this was interesting for y'all and you learned something. And yeah, Ms. Walsh will be going over the list with you to make sure you got everything right on there. Have a great day, guys. Bye.